Dr. Mary Claire Haver, a renowned menopause expert with over 2 million followers, discusses the lack of awareness and support for women going through menopause. She highlights the fact that 85% of women experience menopausal symptoms, but only 10.5% receive treatment or therapy. Dr. Haver emphasizes the need for more open conversation and support for women going through this natural phase of life. Dr. Haver explains that menopause can have a significant impact on women's health, leading to symptoms such as brain fog, changes in sexual function, weight gain, depression, anxiety, bipolar disorder, ADHD, increased risk of cardiovascular disease and diabetes, and recurrent urinary tract infections. She stresses the importance of addressing these symptoms and providing support for women during this stage of life. From an evolutionary perspective, Dr. Haver discusses the grandmother hypothesis, which suggests that there was an evolutionary advantage for women to survive if they stopped the ability to have children at some point. She acknowledges that humans have prolonged their lifespan due to modern medicine, leading to a longer period of dealing with the consequences of menopause. Dr. Haver explains the stages of menopause, including perimenopause, menopause, and postmenopause. She notes that perimenopause can start 7 to 10 years before menopause, with the average age of menopause being 51. She also highlights the importance of recognizing the symptoms and providing support for women during each stage of menopause. Dr. Haver expresses her dissatisfaction with the current medical system's approach to menopause. She shares a personal story from her training, where women experiencing menopausal symptoms were dismissed as whiny women by some medical professionals. She also discusses the impact of the Women's Health Initiative study, which led to a decline in the use of hormone replacement therapy for menopausal symptoms. Dr. Haver emphasizes the need for better support and awareness for women going through menopause. She encourages women to share their stories and experiences to normalize the conversation around menopause. She also advocates for a more comprehensive approach to menopause, including hormone therapy, cognitive behavioral therapy, and lifestyle changes. Dr. Haver discusses the benefits of hormone replacement therapy, HRT, for women experiencing menopausal symptoms. She emphasizes the importance of starting HRT early in perimenopause to reduce the risk of cardiovascular disease, diabetes, and dementia. She also encourages women to prioritize their health, including getting enough sleep, exercising, and focusing on strength training. Dr. Haver acknowledges the impact of menopause on relationships and divorce rates. She notes that women going through menopause may prioritize what is important to them and may not receive the support they need. She emphasizes the importance of open communication and support for women during this stage of life. Dr. Haver acknowledges the stigma and shame associated with aging and menopause. She encourages women to speak openly about their experiences and challenges the societal norms that contribute to the stigma. She emphasizes the need for a more supportive and understanding approach to menopause. Dr. Haver highlights the disparity in funding for women's health research, particularly in the area of menopause. She notes that only a small fraction of the overall research budget is allocated to women's health, with a majority of the funding focused on fertility issues and pregnancy. This lack of funding has resulted in a lack of education and resources for women going through menopause, leading to a significant impact on their quality of life. The podcast delves into the concept of inflammation in the body, distinguishing between acute and chronic inflammation. Dr. Haver explains that menopause can lead to a significant increase in chronic inflammation due to the decrease in estrogen and testosterone levels. She emphasizes the importance of reducing inflammation through dietary choices, such as increasing fiber intake and ensuring adequate levels of vitamin D. Dr. Haver discusses the benefits of fasting, particularly in reducing systemic inflammation and lowering insulin levels. She recommends a 16-8 fasting approach, where individuals fast for 16 hours and have an 8-hour eating window. She also highlights the impact of fasting on neuroinflammation and the potential benefits for overall brain function. Dr. Haver introduces the Galveston diet, which focuses on anti-inflammatory nutrition and fuel refocus. She emphasizes the importance of incorporating fiber-rich foods such as avocados, chia seeds, nuts, berries, and cruciferous vegetables, into the diet. The diet also prioritizes vitamin intake and protein consumption to support muscle mass and overall health. The podcast addresses the topic of hormone replacement therapy, specifically addressing the misconceptions surrounding its safety and efficacy. Dr. Haver discusses the Women's Health Initiative study, which initially raised concerns about the increased risk of breast cancer associated with hormone replacement therapy. She clarifies that the study focused on a specific combination of estrogen and progestin, and subsequent research has shown that estrogen-only therapy does not carry the same risk. Dr. Haver outlines her approach to treating menopausal women, which involves a comprehensive assessment of their symptoms, hormone levels, and overall health. She emphasizes the importance of individualized treatment, taking into account factors such as sexual wellness, arousal disorders, and the potential use of testosterone or vaginal estrogen to address specific concerns. Dr. Haver emphasizes the importance of advocating for oneself when it comes to menopause. She believes that society and the healthcare system have failed menopausal women, and it is crucial for women to take charge of their health and seek the help they need. She encourages women to educate themselves about menopause and to be proactive in finding the right healthcare providers and treatment options. Dr. Haver's approach to menopause is rooted in empathy and understanding. She acknowledges that every woman's experience with menopause is unique, and she takes a personalized and science-based approach to help women manage their symptoms. She also emphasizes the importance of having open and supportive conversations about menopause, both within the healthcare setting and in society at large. Dr. Haver's personal history of health complications within her family has shaped her approach to nutrition and lifestyle. She emphasizes the importance of nutrition, exercise, sleep, and stress reduction in managing menopausal symptoms. She advocates for a protein-centric diet and emphasizes the role of nutrition in supporting overall health and well-being during menopause. Dr. Haver acknowledges the role that loved ones, particularly partners and family members, play in supporting menopausal women. She encourages open and empathetic communication and emphasizes the importance of having a support system during this phase of life. She also highlights the need for men to be informed and supportive of their partner's experiences with menopause. Dr. Haver has written a book called The New Menopause, which is set to be released in 2024. The book aims to provide comprehensive information and resources for women going through menopause. It is a culmination of Dr. Haver's decades of work in the field of menopause and is intended to be a valuable resource for women seeking guidance and support during this phase of life.